So at the moment, we have a clear prognostic impact of MRD, but it's not very clear in which cases should you change the treatment that you anyway planned. And the recommendations that are published are rather conservative and recommend, for example, in NPM1 and CBF AML patients not to change the treatment during the course, independent of what MRD shows. However, during follow-up, if a patient increases with MRD, you should change the treatment, of course, and ideally transplant the patient if that's possible. However, we have now mostly retrospective data that kind of give us a glimpse for the future, what we may be able to do in the future. And there we have the favorable risk patients who are usually consolidated with chemotherapy. However, there's data if you are MRD positive that you would benefit from an allogeneic transplantation. Now, if we look at the intermediate and adverse risk patients, they usually get an allogeneic transplantation. And there's also one study that shows that if you are MRD negative, you do as well with chemotherapy as with allogeneic transplantation. So you could spare the patient the allogeneic transplantation side effects. And finally, in MRD positive patients who should undergo transplantation anyway because of their risk profile, there are data that show that increasing the alloreactivity, for example, with a haploidentical donor on umbilical cord blood donor, can improve the outcome and overcome the negative prognostic effect. However, these are retrospective studies, and we need to await confirmation of these to really include that into our clinical routine. Yeah, I think it's a very good signal, that we have 8 newly approved drugs in AML. Of course, how we sequence them, how we apply them is a current debate and needs more experience with that. I hope that the rest of the world also gets these drugs very soon, and then we can base the future treatment on these drugs and on novel combinations, and I'm very much looking forward that this makes a big impact on the survival of the patients and the well-being of our patients.